Hi, I'm Dr. Muhammad Hassan, the Medical Director of the Neonatal Intensive Care Unit at DuBois Regional Medical Center. In our unit, we take care of ill or premature newborn babies. Sometimes, the babies are experiencing problems because before they were born, they were exposed to some drugs like tobacco, alcohol, or illegal drugs like heroin, methadone, cocaine, or methamphetamine. We realize pregnant mothers may use drugs, but like you, we want to give every baby the best start possible. That's why we have created this video. In it, you will meet some of the people in the NICU and you will learn how we can help you and your baby. Please remember, our goal is a healthy pregnancy and a bright future for your baby. First, let's look at the risk of smoking, drinking, or using illegal drugs while you are pregnant. These habits can cause major problems, including miscarriage, premature delivery, and other complications like placental rupture, poor growth of the fetus, fetal brain bleeding and strokes, or birth defects. Second, what are the risks for the babies? When the baby arrives and we cut the umbilical cord, it means a cold turkey cut of the drugs to the newborn baby. This triggers withdrawal signs for the baby, usually within the first week of life. That's why we keep at-risk infants for observation for about 1 week after birth. The withdrawal signs can range from very mild symptoms to severe reactions like seizures. Here are some of the common withdrawal signs for the newborns. Neurological signs may include excessive or high-pitched crying, excessive irritability, jitteriness, seizures, or some GI signs like vomiting, diarrhea, poor nibbling, and some other signs like sweating, excessive yawning, sneezing, fever, rapid breathing, and stuffy nose. To evaluate withdrawal signs, we use this chart you see here, and it is basically containing the same signs we talked about, and we will score the newborn baby every 4 hours. And if the scores are consistently high, which means that we have score of 8 or more for 3 consecutive scores, the infant will qualify to our morphine therapy. Morphine is one of the most common medication used to treat narcotic drugs withdrawal in newborns. It's often used for withdrawal of heroin, methadone, and painkillers like Percocet, Darvocet, and Tylenol with codeine. We usually start with the minimum recommended dose of morphine orally every 4 hours and continue to follow the scores every 4 hours. If the scores remain at or above 8, we gradually increase the dose to recommended maximal dose, and if the scores remain high, we can add a second medication such as phenobarbital. Once the baby begins to improve and the scores remain below 8, we will gradually start weaning the baby off morphine. This process usually takes 2 to 4 weeks in the NICU. Then the baby will be ready to go home.
Hi, my name is Melissa Fry. I'm one of the registered dietitians in the NICU. In the months after birth, a baby grows faster than at any other time in his or her life. That's why proper nutrition is so vital for your baby's healthy growth and development. Babies experiencing drug withdrawals may have special nutrition needs. A dietitian can create a special plan to help at-risk newborns get the extra nutrition they need. The first choice a mother makes is to breastfeed or use formula. The NICU team is a strong supporter of breastfeeding. It provides nutrition and immunity benefits, and it can help you bond with and comfort your baby. You and your doctor can discuss whether breastfeeding is right for your family. It's important to know that some babies going through withdrawal experience diarrhea and irritation in the diaper area. If you're not breastfeeding, the dietitian can recommend infant formulas that may help calm the symptoms of diarrhea and provide comfort for your baby. Some infants may also require additional calories beyond what breast milk alone or a regular formula can provide. In these cases, the dietitian can recommend how to provide extra calories and protein to help your baby grow and gain weight. We keep a close eye on our little patients, and we monitor the NICU babies daily for weight gain, fluid intake, and feeding tolerance.
Hi, my name is Marian Murrin, and I'm a speech-language pathologist. As part of the NICU team, I complete a neurobehavioral assessment on the babies. That means I check the baby's reflexes, response to noise and light, and overall condition, be it crying or calm. Babies born to drug-addicted mothers can have delays in motor skills, like crawling and walking, and in speech and language development. That's why it's very important that families attend the DRMC Developmental Clinic after discharge. The developmental clinic team consists of a doctor, nurse, physical therapist, and speech therapist. The team checks the baby's length and weight, as well as motor skills and communication skills. We then work with the parents, pediatricians, and early intervention specialists to find the best programs for each individual baby. If your baby is showing any delays, we can refer your little one for hospital and community services. We recommend coming to the developmental clinic on a regular basis until your baby's second birthday.
As a registered nurse in the NICU, my main goal is to keep our little patients as symptom-free and comfortable as possible. To do this, we check on the babies frequently and evaluate their physical symptoms based on a special scoring system called the Finnegan Scale. The doctor uses this information to decide if medication is necessary. We believe in the importance of parents spending time with their new babies. We encourage frequent visits, hands-on care, and nesting in. Breastfeeding is also very important, and we encourage mothers to breastfeed or pump and save their milk for feedings while they're away. Registered nurses will also be a part of the developmental follow-up clinic. We're with you all the way through your pregnancy, birth, and early stages with your new baby. We can be your biggest advocate, and we're always ready to listen.
My name is Pam Donati Simmons, and I'm the social worker in the NICU. I can help you and your family during your baby's hospital stay. Having a baby hospitalized can be very stressful to parents. Finances, transportation problems, and other stressors can add extra pressure. We look at each family to see how we can best help you. As a social worker, my job is to refer you to the right community resources. We encourage you to be involved as much as possible. We are happy to share helpful tips for calming babies experiencing withdrawal from drugs. For instance, as you heard earlier, breastfeeding can ease a baby's withdrawal symptoms and promote good bonding. Swaddling your baby is very calming, and so is keeping the room dark and quiet. We also recommend that you let your baby sleep deeply without interruption. When you're ready to be discharged, our team will help develop a plan for the baby. This usually calls for home health follow-up visits and a referral to the developmental clinic. Our goal at DRMC is to treat families with respect. If I can leave you with one message, it's that I hope that you will take good care of yourself during your pregnancy, eat right, see your physician, and make smart choices.
Hi, my name is Suzanne Wortman. I'm the clinical pharmacist on the NICU team. I review the medications prescribed for each baby. We also review the medicine a mother was taken prior to delivery. This helps us anticipate potential needs for the newborn. If a mother was taking a narcotic or drinking and smoking regularly, the baby may experience withdrawal. That usually happens within the first week of birth. If the doctor prescribes morphine therapy, I help calculate the dosages necessary and monitor the baby's progress. We watch the baby carefully and adjust the dose as needed. Babies sometimes need other medications to reduce the discomfort and symptoms, like reflux and diarrhea. Pharmacists can help here too. We can make recommendations, and we work closely with a doctor and other members of the team to choose the right treatment.
Thank you for watching this video. I hope you found it helpful. At DRMC, we will always advocate for the mothers and their babies, and we always strive for and accept nothing but the very best for the babies in our care. Please, if you have any questions about pregnancy, drug use during pregnancy, or babies experiencing withdrawal, please talk to our doctor today or call us anytime at DuBois Regional Medical Center at 814-375-6428. We look forward to welcoming you and your future babies at DuBois Regional Medical Center. Thank you.